Welcome to Audio Able, an extension of our blog at Able United. We know there are a lot of resources available, and navigating them can be overwhelming. So we created this series to help you. We'll take a deeper dive into the important issues and topics affecting the disability community. We'll also get to hear from guest speakers who serve or represent individuals with varying disabilities and experts on available resources. We hope you'll spend some time with us to listen in. Now, let's get right to it.
Well, it's March, which means it is Developmental Disabilities Awareness Month. And for those of you unfamiliar, this annual observance seeks to raise awareness about the inclusions of individuals with developmental disabilities in all facets of life, as well as the barriers that individuals with disabilities still sometimes face when connecting to their communities. So developmental disabilities include diagnoses such as cerebral palsy, autism, muscular dystrophy, Down syndrome, and affect a person's growth or cognition. Recent estimates in the United States show that 1 in 6, or about 17%, of children aged 3 through 17 years have one or more developmental disabilities. So for this episode, I am joined by Margaret Hooper, Director of Public Policy and Advocacy at the Florida Developmental Disabilities Council, also known as FDDC. Margaret, welcome to Audio Able.
Oh, thank you so much for having me. I'm glad to be here.
Of course. So take us back to 1987 when the Developmental Disabilities Awareness Month first became a reality. Why was this recognition so important for the disability community?
Well, that was the year of the Americans with Disabilities Act, which was a big step forward in recognition for people with disabilities. And I think the banner was to include people with disabilities in the community and help get people out of institutions and a more hidden life. You know, we wanted people with all abilities to be able to enjoy the community with everybody. I think progress from the Americans with Disabilities Act can be measured by the amount of people that are now in the community who receive Medicaid. So, for example, in 1987, 9 out of 10 people who had a developmental disability and were on Medicaid services were living in an institution. And today, 9 out of 10 people receiving Medicaid are living in the community. So I think that's a good example of the progress we've made, although there are still more people that want to be able to receive supports to live and work in the community. So we work every day to make that happen.
Love that. So in terms of helping to spread the word about Developmental Disabilities Awareness Day, how can people get involved both on a national and statewide level?
Well, our Developmental Disabilities Awareness Day is March 14th this year. If you go to www.fddc.org, you will see right on our front page our flyer for Developmental Disabilities Awareness Day and the activities. And we also have a toolkit to have a local DD day on our website for people that can't make it up to Tallahassee. Our lawmakers, local and state, have local offices for people to be able to visit and write emails and make phone calls. And also, examples of the legislative priorities we are working on are available for people that want to give somebody, print out a handout to give to people, a flyer, that kind of thing. And then also it'll take you to www.ddday2023.org, where you can register for the virtual DD Day portion that's from 8:30 to 10, where you can look at different speakers we have for the day, and everyone will be able to do that no matter where you are in the state.
That's great.
And then, of course, Facebook will have a lot of good Facebook materials. Share with your friends, like our page. let people know to register for the virtual event, band together with some friends or groups and have a local DD day. And really, you can use these materials all month because March is Developmental Disabilities Awareness Month.
That's right. Now, I also want to touch on the role that you all play within the disability community. Can you go into further detail about that?
Yes. In 2000, the Developmental Disabilities Act was passed, and every single state would have a Developmental Disabilities Council, a protection and advocacy agency that's kind of the legal arm of the DD Act. And in Florida, it's Disability Rights Florida. Mm-hmm. And then 2 university centers of education for individuals with developmental disabilities. The Florida Center for Inclusive Communities and the University of South Florida, and the Mailman Center for Children out of the University of Miami.
Right.
So all 4 of us represent the DD Act in Florida. And our council is 100% federally funded. And we implement contracts for innovative programs to increase the capacity for people with developmental disabilities to work in the community. So, for example, right now we're working on including people that are dually diagnosed with a disability and a mental illness. And for aging caregivers, to help aging caregivers be able to transition their loved one into the community, or a way that both people can be transitioned together as they both age, because aging caregivers is really becoming an issue, especially in Florida.
Yeah.
And people with developmental disabilities are living longer. So we're trying to come up with ideas and ways to provide services for that group.
That's great.
And then finally, just increasing information about services and access to services. A lot of people don't know what's available. So we're also working on awareness campaigns and probably some technical ways, websites to help people be able to navigate a complicated system.
Sure. I mean, I think for anyone that's navigating a diagnosis, the amount of resources and services available is quite overwhelming. So being able to utilize the council kind of as that way to streamline and have like a running list of all resources and services available, I think is critical.
And the governor of every state appoints council members based on the population of the state. And 60% of those council members need to be self-advocates or a person with a developmental disability. And that's a disability they got before the age of 18. Wow. And then, or a family member. So it's definitely grassroots driven that way.
Right. And so important to have that 60%, right? I mean, They are the individual with a disability. They are the ones that are living day to day in the community and know what their needs are and how, what types of resources and services that they need to be successful at the end of the day.
Yeah, they say nothing about us without us.
I love that. I love that. Now, at the time of this recording, Florida's legislative session is on the horizon.
Yes.
And I know that each year you all develop a platform, and this year you're really focusing in on Florida's home and community-based services Medicaid waiver.
Right.
Can you tell us a little bit more about this priority this year?
Sure. We actually always do something with the iBudget home and community-based waiver that's specifically for people with developmental disabilities, and people who are on that waiver are waiving their rights to institutional care, but they have access to a lot of different services that will help include them in the community. And after the pandemic, I think our whole healthcare system is suffering from finding service providers, anywhere from nurses to behavior analysts and support coordinators and people like that who help make the waiver system work and the service system work. So we were asking legislators to invest in the home and community-based waivers by, of course, providing money to get people off waiting lists that we unfortunately have, but also be able to incentivize the workforce. And they did that last year. They invested a lot of money to increase personal support providers up to minimum wage of $15 an hour, which was really big. But we have, unfortunately, we've got behavior analysts who it's hard to find, and that's a really important service for people in crisis. And then the support coordination piece of these are the people that help you find the services if you actually get on the waiver. And people are having trouble finding those folks so they can get started with their services. So we're working with the legislature on ways to improve the workforce in those areas, as well as get people off the waiting list. We always support that every year.
Yeah, absolutely. So always my last question for guests, and what do you hope listeners will take away from today's conversation?
That people with disabilities are part of our community, and to look for ways to include people, to help them take part in community activities and church activities, employment, very important, and
very important.
And support the idea of people getting supports to be able to enjoy those activities. And people with disabilities need the kind of personal supports to actually help them physically get out of bed, for example, and get started on their day. Or in a case of a person with an intellectual disability, they need some guidance of how to access different systems. Even though they physically can access them, they may not be able to figure it out and could use some support. Now, both of those services are not provided on standard insurance. Right. And even basic Medicaid after the age of 22 does not provide those services in Florida. So that's why these waivers are so important, because they do provide those support services that you need to live, work, and play in the community.
That's right. And for those that are receiving the Medicaid iBudget waiver, they can actually save with Able United without impacting the benefits once they do receive them, which is so great, because they can then, seek employment and, start to save money in their Able account without it impacting their benefits. Such a pleasure to sit down with you today for Audio Able. If you are in the Tallahassee area on Tuesday, March 14th, Able United will be an exhibitor at FDDC's Developmental Disabilities Awareness Day at the Florida Capitol, and we hope to see you there. To learn more about all the incredible things FDDC is doing to help individuals with intellectual and developmental disabilities, visit their website at fddc.org.
Well, that's it for now. Have topics you'd like us to address? Interested in sharing a resource? Drop us a line at info@ableunited.com. Thanks for listening in, and we'll catch you next time on Audio Able.